What if hearing loss wasn't just about your ears, but was actually rewiring your brain, making you more vulnerable to depression, anxiety, or even PTSD? A massive 15-year study of nearly 2 million people found exactly that, and yet most people, even doctors, aren't talking about it. So today, I'm going to walk you through what this research uncovered, why hearing loss and mental health are so deeply connected, and what early treatment can do to protect not just your hearing, but your peace of mind. Okay, let's start with the study that blew this conversation wide open. In Taiwan, researchers followed nearly 2 million people for 15 years. Out of that group, around 86,000 had hearing loss, and about 346,000 people didn't. And here's what they found, and it's not subtle. People with hearing loss were 2.6 times more likely to develop a psychiatric disorder. PTSD and stress disorders, more than 3 times higher. Depression and anxiety, again, 3 times greater risk. Even issues like bipolar disorder, sleep problems, and eating disorders showed up more often. This is not one of those small sample studies buried in a footnote. It is one of the largest of its kind, and the message is clear. Hearing loss isn't just frustrating, it's reshaping your brain and mental health in ways we can't afford to ignore. Quick pause. If this content matters to you, hit the like button and subscribe. It helps us reach more people who need to hear this literally. So why does hearing loss hit our mental health so hard? Well, part of it's emotional, and honestly, that makes a lot of sense. Imagine this. You're at family dinner. Everyone's laughing at something, but you didn't catch the joke. You smile, you nod, you pretend, but deep down, you just feel lost in that room. That doesn't just happen once, it happens over and over at work, at church, in conversations with your wife and kids. And over time, that causes people to start pulling back. They stop going out. They stop engaging with others. That slow drift into isolation, it's one of the fastest on-ramps to depression and anxiety. But it goes deeper than that. Brain scans show untreated hearing loss actually causes parts of the brain to shrink. The areas that process sound weaken, and that decline spills into other parts of the brain responsible for memory, emotion, and cognition. It's not just harder to hear. Your brain is literally changing. Let me tell you about a patient named Eleanor. When she first came to see us, she just wasn't herself. She was withdrawn, irritable, and clearly struggling. Her family suspected hearing loss, but Eleanor resisted, saying, "My hearing's fine. I don't want to be one of those people with hearing aids." I smiled and said, "You know what? Neither did I." But here we are, and now I don't miss a single dad joke at dinner. She chuckled and thought that was kind of funny. She let us do the hearing test, and it did reveal a significant hearing loss. We fit her with the right hearing aids and began a long-term treatment plan for her. 3 weeks later, they came back to their follow-up visit, and her daughter told me, "I've got my mom back." But it's what Eleanor said that struck with me most. I didn't realize how much of my life I'd been tuning out, not just the sounds, the people, and the moments. At her 6-month follow-up visit, she told me that she was hosting dinners back in her book club and laughing again. That's what treating hearing loss can do, not just for hearing, but for healing. Here's something else that the study revealed that we can't ignore. Timing matters. The risk for PTSD and stress disorders are highest within the first 5 years after the hearing loss is diagnosed. This tells us something huge. There's a window, and when we catch hearing loss early, we can stop this mental health decline before it even starts. The risks also rise with age, stress levels, and other health conditions. So the longer we wait, the steeper the climb becomes. The message here: early actions change outcomes, period. And here's the good news, and it's big. This whole cycle is preventable. Research shows that hearing aids and cochlear implants don't just restore hearing, they actively lower the risk of psychiatric disorders. In many cases, they help people feel better emotionally, often for the first time in years. Because when you can hear again, you reconnect, you participate, you laugh at the jokes, and you stop pretending and start living again. That's the real power of hearing care. We need to stop treating hearing loss as just an ear issue. It's a brain issue, and many mental health professionals and hearing professionals need to start working together now. So let's bring this all together. Hearing health is mental health. If you or someone you love is struggling with mood, energy, or disconnection and been putting off getting a hearing test, now is the time. We created a free vitality report with 9 powerful ways to protect your hearing, sharpen your brain, and feel better all around. You can download it. Now I'd love to hear from you. Have you noticed changes in your mood or energy along with hearing loss? Did treatment change your life like it did for Eleanor? I'd love to hear your story, and others will too. I'm Dr. Layne Garrett. Thanks for watching, and remember, better hearing doesn't just improve sound, it improves your whole life.